The signs are everywhere. Urgent care centers, freestanding emergency centers, hospital-based and hospital-affiliated emergency departments. Do you know where to take your child for a quick, qualified care without overpaying? We have answers in tonight's special report, and you'll see it only on ABC 7.
We have the older station that had 10 beds, and then we added another 10.
El Paso is home to more than 15 urgent care centers. Dr. Alan Carpenter worked in emergency rooms more than a decade before opening Upper Valley Urgent Care.
I told my wife, let's open a place that's for people that have minor problems and let them get in and get out. And they're starting to open across America.
A trade organization says 84% of urgent care patients get in and out within 60 minutes. Carpenter says that's not all.
So the urgent care is going to be the one of the most affordable. Now, your doctor's office visit is always the most, but it may be a 4-week wait. The urgent care, you can come in and be seen when you want to. Costs a little bit more, but not near as much as an emergency room.
If they're needing any emergency diagnostics, the CT scan and x-ray are right here.
Next month, Dr. Bob Phelan plans to open his second Sun City Emergency Center in El Paso.
There's a need for the freestanding emergency room, and it serves that need. We're eliminating the wait that you have in the traditional emergency rooms, and you're going to be seen by a doctor fast, and it is cheaper.
A 2010 state law allowed freestanding emergency rooms. Close to a dozen have opened in El Paso, some affiliated with hospitals.
We are expensive like a hospital, but we are cheaper than a hospital.
Dr. Phelan believes they excel by having everything in one place.
You're not having to go up 2 flights of stairs, around the corner, the elevator to the CT scanner at like a traditional hospital, but your diagnostic equipment's right there in the ER. Your x-rays in the ER, your labs in the ER. All your resources are right here in the emergency room.
Still, in some serious cases, you might ultimately end up at a hospital.
Stroke, heart attack, major trauma, needing a surgery, like a gallbladder, something as simple as, oh, I have right upper quadrant pain. Well, turns out to be a gallbladder. They're not going to be able to help you at a standalone freestanding. You're going to need to get a surgeon. You're going to need to go to the hospital.
Dr. Kenneth Beduman has a way to determine if you need a hospital ER or can visit a freestanding emergency room.
If you feel that you're really going to require an admission or you're requiring a surgery, it's best to either come to a hospital-based ER or a hospital-affiliated ER, and that way life is just much more simple for you.
Nowhere is the proliferation and lack of fear over competition more evident than right here on the corner of Loop 375 and Edgemere. In the distance is a MedPost Urgent Care Center. I'm on the East Campus of the Hospital of Providence, which has its own emergency room, and then across the street is a Neighbors Emergency Center, and across the highway a Sun City Emergency Center, all within feet of each other.
We're not so much in competition. We actually tend to complement each other, and it's a free market, fair market, and it's good for the public. They have different choices.
Providence says there were more than 325,000 emergency department visits in El Paso last year.
In a city this size, there is enough work out there for all of us. It's just a matter of we want to make sure that people are directed to the correct place for their optimal care.
A spokesperson with Neighbors Emergency Center tells me privately owned standalone emergency centers like Neighbors, Sun City, and Complete Emergency Care cannot accept Medicare or Medicaid because they are not federally recognized. We have a list of which type of facility might be best for you based on your symptoms and the financial impact on our website, kvia.com. Just search emergency rooms or special report in the top right search bar.